When a person hears remission after fighting cancer, they often view it as a win, a sign that a tough journey is over. For many, it seems like they are reclaiming their lives. Yet remission is not always as simple or joyous as it appears. While it signifies an important step, it also introduces its own difficulties, doubts, and emotional struggles. So, is remission really what people think? The answer is not so simple. Remission indicates that the signs and symptoms of cancer have reduced or are gone. This can be a partial remission, where cancer is still there but lessened, or a complete remission, where there are no signs of cancer in the body. However, remission is not the same as being cured. Cancer may return, sometimes many years after treatment, resulting in ongoing uncertainty. For many who survive cancer, remission does not always bring the expected relief. Instead, it can lead to new fears. Survivor's guilt is common among those in remission, especially if they have lost fellow patients. They often experience an inner struggle between feeling fortunate to be alive and feeling sorrow for those who are not. Moreover, fear of recurrence remains significant for many. The term scanxiety refers to the worry patients feel before checkups, anxious about whether their cancer has come back. This persistent fear can overshadow the joy of remission, making it tough for survivors to move forward. It can feel like a shadow that is always there. Even after achieving remission, cancer survivors frequently face long-term effects of their treatment. Chemotherapy, radiation, and surgery can have lasting consequences on the body. Fatigue, nerve pain, memory issues, and other side effects can linger for years. These ongoing health problems can complicate daily life, even when cancer is no longer present. For many, remission does not mean a return to their previous health. Additionally, some treatments may have weakened a patient's immune system, making them more susceptible to infections. They might also need to continue medication or monitoring to keep cancer away. These physical challenges can be exhausting, both mentally and physically, leading many to question if remission is truly a release. Social and emotional changes. Cancer impacts both self-perception and how others view someone. After entering remission, many feel pressured to quickly revert to normal life, as if everything is resolved. Friends and family may expect them to act like their old selves, but the survivor might not feel the same emotionally or physically. It's also common for individuals in remission to feel isolated. During treatment, there's often a strong support network: doctors, nurses, family, and friends. Once remission is achieved, this support can diminish, leaving the survivor feeling abandoned or not understood, especially if they are dealing with ongoing side effects or emotional issues. Living with doubt. One of the toughest aspects of remission is coping with uncertainty. Remission does not ensure that cancer won't return. Survivors often wrestle with the unsettling possibility that their cancer could come back at any time. This uncertainty can be overwhelming, making it hard to plan for the future or fully relax. Some survivors manage by being overly cautious about their health, while others might try to ignore their anxiety entirely. Regardless of the approach, carrying this emotional weight can be significant, often impacting mental well-being. Many survivors experience depression and anxiety even after remission. Benefits of remission. Even with difficulties, remission gives hope and chances. It allows many to rebuild their lives and savor their time. Some survivors discover new goals following their diagnosis, following interests they once delayed, or adopting a fresh view on life. Remission can also provide a moment for growth and strength. Many survivors find a stronger sense of empathy, thankfulness, and resilience after facing such a big challenge. The journey through cancer treatment can create a new respect for life, even if things are not as they were. Moving forward, thinking about remission. To ask, is remission all it's made out to be? It varies by person. Remission is a key point in the cancer path and offers hope, but it's not the easy win that some think. It's not the end, but a new chapter in life, with its own challenges and accomplishments. For those in remission, it's important to deal with the emotional, physical, and mental effects of cancer. Support from family, mental health experts, and survivor groups can be vital for navigating this tricky time. Knowing that remission does not mean cure and that the journey ahead may still present challenges helps both survivors and their supporters approach this stage with care and understanding. In the end, remission can be a blessing, but it also reminds of the losses and gains and the unknown future. By accepting both the good and the tough, cancer survivors can move forward with strength, hope, and a broader view of life.